Okay, the Parodneck is my maiden name, and those are where my credentials are at. So I am a graduate of Sarah Lawrence College, New York Medical College, and I did my training in obstetrics and gynecology at NYU Bellevue. I then had a career in OBGYN on the Upper East Side, and the hospital we were affiliated with was St. Vincent's, and they closed in about 2010. So I figured for me, that's it for medicine. But I do continuing medical education stuff and took the cannabis course, and it was really, really bad. I learned nothing. So I decided, let's check this out for real. So I read a lot, toured the Vireo dispensary in White Plains, and decided, all right, I give it a shot. So here we are. So I am following the Compassionate Care Act in New York, which was enacted under Governor Cuomo. It was RAIN in 2014. In 2016, they opened the first medical marijuana dispensaries in New York. The closest ones to this area are Vireo in White Plains, Curaleaf in Newburgh, Etain in Yonkers, and they all have delivery. So what we do is looking at medical marijuana first is who's an appropriate candidate. In New York State, there are a number of qualifying conditions. The most common is chronic pain. Chronic pain, by definition, is 13 weeks of pain or more, and it can be anything from IBS, Crohn's, to migraines, fibromyalgia, bunions, toe issues, hand issues, any kind of pain, endometriosis, premenstrual syndrome, and the pain associated with getting pelvic pain. It's all included. Then there are a number of neurologic issues, such as ALS, MS, Huntington's chorea. They all qualify, and those patients do really well with the non-psychoactive components of the cannabis. Other conditions include spinal cord injury, cancer, HIV, AIDS. And then as of December, there'll be new rules and regulations added. And in the new rules and regs, a doctor who practices cannabis medicine will have the right to decide if a patient warrants treatment. They don't have to be on the New York list anymore. So besides the things I've discussed, there's also cancer. Spectrum is, I have a number of patients on the spectrum who work with these oils and do really well, but they come in under PTSD or chronic pain. So it's a matter of the clinician figuring out if a patient wants to do the program or the family really wants to give it a shot. We all work together to figure out how to do it and what condition we're going to use. So looking at the plant, there have been over 400 active chemical components identified. Within the cannabinoids, that's just a class of organic compounds. We have THC and CBD, which are the most common compounds in cannabis. The THC is your classic pot. That's what gets you high, meaning it's a euphoriant. It's also really helpful for pain, relax, sleep, chill out, as we call it. And that is what we look at and call the indica THCs. We also have sativa THCs. The sativa THCs are bouncy, energetic, and it more of an influence on the mind. People find they like to clean the house, do bills, all kinds of mentally stimulating things are done with the THC, the indicas, and then the hybrids are a combination, some head issues, some body comfort and issues. And looking at the THC, if it's too much, we can bring our patients back to planet Earth. No one has to ever be too high. If we add lemon juice, black peppercorn, biting into pine nuts, hydration, hot shower, and CBD, will bring anybody back to Earth. The CBD component is non-psychoactive, meaning it can help with anxiety and depression, but people can still use heavy machinery. It doesn't interfere with reflex time. They can drive, they can do whatever they need to do. So the CBD component it's a neuroprotectant, helpful for anxiety and depression. It also quells seizures. It helps with pain a little bit. It has some of the nice attributes of THC, but THC is really the one-two punch with certain disease processes. So in looking at a patient, number one is what's going on with them. The qualifying condition gets them in the door, but then we really have to look at the patient and see what's going on. So my consults usually take about an hour, and we start with what's going on with patient. What's their day like? What time do they get up? Are they able to move? Is their pain worsen over the day? Are they sleeping okay? How's their appetite? And really what we're dealing with most of the time is anxiety, depression, insomnia, appetite issues, and pain is really 90% of the patients who walk in the door. That's their issue. So by breaking apart the day and putting it back together, we'd really try to help patients figure out what's going on and give them a better day. So we work with the milligrams of the active components as well as the ratio. Once you have 6 parts CBD to 1 part THC, the level of psychoactivity is really pretty low. So a patient can be on that kind of regimen and drive a car, do whatever they need to do. Now, when the patient comes to get certified, they speak with the clinician, go over the day, get a basic understanding of the New York program, and then paperwork is done. Patients need to be enrolled in the Department of Health program, which the clinician does, and then patient goes home and either by phone or on the computer, they then register for what they call their card. After they do the card registration, they can print out a temporary, and then they're able to go to the dispensary. When they go to the dispensary, first time, they need to speak with the pharmacist. They go over what their underlying condition is, as well as what's going on. And it's one more time to have an interaction, listen, and learn more about the products. So I encourage patients, don't do it on the phone, go in person. And at the time of the consult, they will go over exactly what are they selling it at the dispensary. So all dispensaries are carrying the tinctures, which is an oil that you put under your tongue. You can just put it plain under the tongue or introduce it into a high-fat food like avocado, peanut butter, Nutella. If we introduce it into the food, it takes about an hour to kick in, but it'll give us a longer duration of action. So it's a really nice sleep formulation. All the dispensaries have gel caps. They all have the vape pens. And there was the vape pen scandal about 2 years ago where people were using these vape pens and ending up really, really sick, some even dying. Well, there were no dispensary products implicated with all that. What it was street products using vitamin E acetate as a carrier agent, which is a really cheap garbage oil. So it was not the cannabis, but it was the carrier oil from illicit sources. So lesson learned with that one. The dispensaries also have sprays. There's mint spray and then there's berry spray. They also have ground bud. In the original provisions, there was no bud permitted, but then they were able to introduce ground bud. So if it's ground to 2 millimeters or smaller, then patients are permitted to buy it. Curaleaf has been selling the most ground bud. At one point, somebody ratted them out because they had big nugs and they weren't ground to 2 millimeters. So everything was pulled off the shelves and had to be repackaged. Theoretically, in New York, there are no edibles. However, there are honey lozenges and they're gummies. They have cherry, lemon, and orange. So what you'll find is that there are a lot of rules. However, the rules can be pretty flexible. So it's a matter of finding what you're comfortable with and working with the products. The legislation stipulates that in December, recreation will be legal in New York. They say that the dispensaries will not open until 2023. But as of December, patients will be able to grow their own plants. And they're saying that each patient can grow 6 plants and a caregiver can take care of up to 6 patients' plants. So maximum cap is 36 until the new program is fully up and running, and then regular people will be able to grow their own plants as well. and growing for sale is all going to be highly licensed and highly, highly regulated. You might say, why would somebody need medical when you can go to any high school and buy cannabis? Well, at the dispensary, everything is tested profusely. Pesticide, mold, heavy metal, and contents is stated. If any of these items are not correct, the batch has to be destroyed. So at least if you're purchasing at the dispensary, you're guaranteed a clean product, and you can repeat the experience. Because if you're buying on the street, you don't know what you're getting. You don't know if it's been laced with any toxic materials. And if it works, that's great, but you don't know if you'll be able to get the same format again. So that's my plug for the dispensaries. And they're also a great way to learn how to work with the products and to get accurate products. One thing that I particularly like doing is coming up with a program daytime and night. People's needs are really different. If somebody is in hospice care or chemotherapy or not able to leave the house, we take care of them. We're not rigid that, uh-oh, this is only day or only night, but it's a way to familiarize people with how these things work. And okay, this is strong, so you shouldn't drive. So we're calling that nighttime. So it's really trial and error, working with the clinician and seeing what works for a patient. Now, with the senior population, my biggest concern is that they're fall risks. So I tend to be a little cheaper with the THC, but I do increase as needed. And I believe in dosing. There's a really nice way to do this in what we call microdosing, which means when patients figure out what works, to basically have a constant state. They're not inebriated, they're not high, but they have the effects of the cannabis as medicine, so they stay comfortable. And that's a really nice place to be. At the present time, the program is still federally illegal, which means at the dispensary, you have to use debit card or cash. It also means you're not supposed to be crossing state lines with your cannabis in your car. There are no troopers sitting at state lines looking to see who has pot or not. TSA has come out and said they're not looking for recreational users. They're not looking for medical patients domestically. They're looking for terrorism. So things are pretty open domestically, but internationally, I have patients call embassies, a friend, don't use your phone, but they call to find out what is the country policy. Grand Caymans is zero tolerance, Egypt, Turkey, Singapore, no cannabis, Morocco, no cannabis. So when traveling, you have to be careful because we don't want to see seniors going to jail. That just would not work. So I've spoken for about 20 minutes, the basics of the program. Why don't we do some Q&A so I can hear what's important to you guys? How does that sound?
That sounds good. I am going to, so if people have any questions, either you can put them in the chat or more easily, if you raise your hand, I will unmute you so you can ask any questions you might have. And while we're giving them a moment to do that, I want to thank you. It was actually very interesting. There's a lot of things I didn't know, especially about the vape pen, which is very interesting because everybody got bonkers about the inhaling of it, and it wasn't the
It wasn't the pot, it was the
right,
cheap oil.
the carrier. Very interesting. I thought that was very interesting. So, okay, folks, come on. Somebody's got to have questions. There's a whole bunch of you out there. Anybody with any questions? Because we'd love for you to ask her some relevant questions. I'm going to try and think of one myself. Um, so where I know you said this in the beginning. Where are you practicing out of?
I'm in Bedford. I am on Maple Grove Farm, which is a 200-year-old farm, and I have the carriage house.
Oh, very nice.
So we get to have a good time. I have two dogs that run around, although they can go in the garage if necessary.
Okay, great. So is there any special requirement for somebody to come to somebody to look for the medical marijuana? I mean, how do they, somebody says, this is something I think might help me. What would be their first step?
The first step would be to find a clinician to get them certified. Um, MDs, osteopaths, as well as nurse practitioners and PAs can do this. And the clinician has to take a course with New York State, to pass it, and then they can do this. And actually, we're just designed to be gatekeepers to say, okay, guys, you want to work with cannabis, here's the paperwork, you can go. But I believe it's really important that patients understand it and that their families understand it, because then you can work with it and get the best results. If someone gives you a piece of paper, it means nothing.
Right.
But I believe sit down, learn, and read. I give patients URLs. My favorite website is Project CBD. So if somebody is kind of curious but not ready to make the phone call, it's a great place to start. They have a lot of good articles. They're not about animals. They're written for people, not PhDs. So it's a really good site.
Great. Okay, I have somebody who asked a question. Can you review again the difference between THC and CBD?
Sure. THC is psychoactive. It's what we call the classic pop. Well, you know, when people smoked in high school, it was the THC. CBD wasn't even identified. So the THC without the CBD in it, in New York, all the products have both THC and CBD. They tend to be dominant. So you would have a product that would be 95% CBD, 5% THC. We have the combination to do what we call drive it. So it becomes what they call an entourage effect. It's a 2 + 2 = 7. You need less medicine. It works better by having the combo. So the THC is euphoriant. First and foremost, it's that classic high. It's also really helpful for pain, sleep, muscle contractions. A lot of the neurologic diseases have, spasms, and this allows muscles to relax. So people feel much more comfortable. It is also stimulates appetite. So people in cancer treatment find it really helpful when they're doing chemo, they have nausea and vomiting. Using the THC products, they feel much better and can complete the chemo. They don't drop out as often. Also, it helps with anxiety. Some people do better with the CBD for anxiety, some the THC. The CBD is anti-inflammatory. It's also a neuroprotectant. It also is helpful for anxiety and depression. It puts people in the middle of the road and they can still operate a car, heavy machinery, no problem at all. Too much, it'll make somebody sleepy. So people will use it for sleep, but what they're really doing is like using too much of a therapeutic dose to sleep, and they wake up okay in the next morning, so it's all right. There's also minor cannabinoids that are getting a lot of press these days. There's delta 8 THC, which is psychoactive and it's legal over the counter. You can go into a vape shop and purchase it, but that one is like THC light. It's not as intense as regular THC. There's also CBN, which is great for sleep. There is THCV, which is good for weight loss and focus. And there's CBG, which is called the mother cannabinoid. When people with MRSA do much better when they're working with that in other bacterial infections. And then there's CBC, which has been found helpful for skin, hair, and muscle health. So there's a lot of new stuff coming up. But the problem is because this is considered a class 1 substance, it's considered federally illegal. So research is really limited. The best research on cannabis is out of Israel, and Dr. Meshulam's lab has done the most work, and they've really done an amazing job. Germany has good research. In this country, we've been using cannabis from University of Mississippi, one strain for the research. And now other universities are being approved, and there are research centers that are allowed to grow different strains, not just one. Because also remember, different diseases respond to different strains. The strains of the cannabis are like the funky names. Back in the day, there was Maui Wowie, Acapulco Gold. Now it's birthday cake, Kush, all these funky names. And the funky names, actually, you can look in Leafly, Leafly. It's basically a cannabis information website. It's not AMA approved or even recognized, but they describe the different attributes of a strain. For example, Pineapple Express is classically giggly. So they'll have in there euphoriant, happiness. They'll have all the traits of it. And they'll also have the side effects. Cannabis can also cause dry mouth, which can be uncomfortable, dry eyes. Certain strains cause more munchies than others. So it really depends on what's bothering you and what side effects are you able to tolerate.
Oh, I'm not actually seeing any other questions, which I'm super surprised. I thought there would be a ton of questions. I'm going to give people one more chance. And if nobody has any other questions, then we will happily thank you. And how do you pronounce your last name? Your
Parodneck, my doctor name. My patients call me Lynn. We
they
keep
call
it
you Lynn. Okay.
really easy. Yes.
That's what I wanted to make sure,
Yeah, Lynn. It's easy.
Well, thank you, Lynn. This has been super informative. And I do think it's really important. I have to tell you that I have seen a lot of the older clients that I'm working with, the kids come in and tell me, well, we got the CBD or whatever for mom. And especially for people with pain and issues like that, it really does seem to be helping tremendously.
Yeah, and dementias also. Dementias are not on the list, but seniors tend to have chronic pain, PTSD. So, what senior hasn't fallen at least once and hurt
Right.
at least their pinky? So, because the CBD is a neuroprotectant, they tend to do well. It also cuts the anxiety. And there are certain strains, Harlequin and ACDC, tend to be really nice strains for dementia patients.
Interesting. That's very interesting, actually. Yeah, I think it seems like there's a whole lot of things that it helps with, and as opposed to just one or two things, which is also I find very interesting because it seems to have a wide breadth of things that it can help with.
Yeah, and it has a very nice safety profile. You don't injure your kidneys, you don't injure your liver, you don't injure organs. So it's much nicer than a lot of the other meds that are out there. And also, I work with patients if they want to get off something. I have a number of people who've gotten off Ambien, and they're very happy to have done so. We work with their doctor who wrote for it as well. It's basically having and having and having and then dumping, but we do it together so that there's no issue. It's really easy to start a number of these medications, but it can be really hard to stop.
Yeah, I have a close friend who had an amputation, and they were on they were on Lyrica and oxycodone and all that stuff quite a while after it happened. And they were able to get off all of those drugs, and they used the medical marijuana, and
It's
they don't
great.
have any pain issues. They're off all those drugs. I mean, it's so much better. It's unbelievable what a difference that was. And every time they go to the hospital, they want to give them the pain meds, and they won't let him use what he uses when he's home. So it's very frustrating.
It's ridiculous. I had a patient who was quadriplegic. He was admitted to Columbia in Cortland. He used a vape pen. He was great. He had pain in that. It was horrible because he couldn't even scratch his own nose when it itched. So he was big with the vape pen. One of the nurses ratted him out. Security took the vape pen. They then wrote him for opioids. And I'm like, Jason, what happened? He goes, you don't get it. Jason was Dominican. So he said to me, they just think I'm another black junkie. That's what it's all about. They wrote me, for all kinds of stuff that I don't want, and they won't let me have my vape pen. And we had a kind of bargain that when he was discharged, he could get his vape pen back. How ridiculous. And they say because of the Clean Air Act. Well, you don't even smell this vape when
Yeah,
you smoke it.
yeah,
So it's really
that's
pathetic, I would say.
Somebody did ask one more question and then we'll let you go. Does it reduce the confusion in dementia patients?
It allows dementia patients to relax. So when you remove that layer of anxiety, people think a lot clearer. They tend to be able to line things up and follow through, where if they're all anxious, they can't even follow the conversation.
Interesting.
So it's not it doesn't have to be because of the neuroprotectant aspect, but the fact that they are relaxed. And for seniors, they always feel pushed. They're not moving quick enough. Everybody's waiting for them. That whole kind of. So this can be really nice.
Okay, and now see, now people are starting to think, would the person with Lewy body dementia benefit from the medical marijuana?
Absolutely. Lewy body dementia is the profile is very similar to Parkinson's. They're interrelated. Some patients with Parkinson's have the Lewy body dementia. And yeah, we work with the Harlequin and the ACDC, and patients do much better.
Great. Great. Well, this has been really wonderful. And it looks like I think that's all the questions. So I want to thank you so much. And this is recorded, so we will be posting this. Usually it takes us a week or so to get it posted up on the boxwood.org website, but it will be up there and it will stay up there. So hopefully people will come that didn't get to come to this live webinar and still get to benefit from the information that you provided us today. So just want to thank you again.
Oh, thank you for having me. And if anybody wants to send questions after, if you think of something, that's fine. And you can use my easy email.
Which is, I'm going to put it in the chat. So tell me what it is.
It's swest, WEST, 9253 at Gmail.
9253 S West.
Yes.
Okay.
It's hijacked. My kids gave it to me about 20 years ago and I haven't changed it. So.
Okay, so I put that in the chat. So if anybody wants to copy and paste it, you can always reach out to info@boxwood.org and we can give you the connection if you miss it today. So again, thank you so much. And I hope everybody has a great evening and a happy Memorial Day weekend.
Enjoy summer.
Yes, exactly. Thank you so much.
Thank you.
Okay, bye-bye.
Bye.